Hello, everyone. Greetings from Los Angeles, California. My name is Jay Wang. I'm the director of the USC Center on Public Diplomacy. It is my pleasure to welcome you to the CPD Conversation Series. You are in very good company today because we have received requests to attend this event from over 30 countries. And so we are truly in it all together in this time of great uncertainty. At the Center of Public Diplomacy, we are very proud of playing a role in advancing the field of public diplomacy and to help to build the field of public diplomacy into a strong and sustainable facet of global affairs. While we are all currently struggling to understand the lasting impact that COVID-19 will have on our lives, public diplomacy and the work that we do at CPD is more important than ever. And we continue to do what we do best, providing a platform for the constructive exchange of ideas around public diplomacy and share tools, best practices with practitioners around the world. So thank you for joining us today and for your interest and for your support. Today's program explores South Korea's efforts in navigating the current pandemic crisis and the public diplomacy implications. Before we start, I'd just like to mention a few housekeeping rules. So for our audience, your setup is listen-only mode for the duration of the program. And please send questions by using the question tab on your control panel. And I'll see those questions and we'll ask them during the Q&A part of the program. And there will be live tweeting during the event. So please follow CPD's Twitter, also our Facebook, Instagram, and LinkedIn. Now it is my great privilege to introduce two distinguished speakers joining us live from Seoul, South Korea. Dr. Geun Lee is president of the Korea Foundation. Before joining the foundation, Dr. Lee was a professor and dean of the Office of International Affairs at Seoul National University. He has also taught at the Korean National Diplomatic Academy and served as president of Korea Institute for Future Strategies, an independent think tank. He is former chair of the Global Agenda Council on the Future of Korea at the World Economic Forum and currently a member of the forum's Global Future Council. He has many publications, including Clash of Soft Power Between China and Japan, A Theory of Soft Power and a Korea's Soft Power Strategy, and U.S. Global Defense Posture Review and its implications on the U.S.-Korea relations. So welcome, Dr. Lee, and thank you very much for joining us. And our second speaker is Dr. Youngmee Jee. Dr. Jee is the leading public health expert. He is currently a member of the WHO International Health Regulation Emergency Committee on COVID-19 outbreak and of the WHO Scientific Advisory Committee for the Blueprint on Research and Development Preparedness for Epidemics. She is an advisor to the Global Center for Infectious Diseases at Seoul National University. Dr. Jee has served as Director General of the Center for Infectious Disease Research of the Korea National Institute of Health, part of the Korea Centers for Disease Control and Prevention, and was acting director of the Korea National Institute of Health. She also serves on a number of national and international advisory committees, including the WHO Strategic Advisory Group of Experts on Immunization. So welcome, Dr. Jee. I'd like to invite Dr. Jee to speak first on the public health strategies and measures implemented in South Korea concerning the current outbreak. And then Dr. Lee will discuss public diplomacy and broader policy implications as we address the COVID challenge. And after their presentations, we'll open up for questions from our audience, and we look forward to an enriching and stimulating conversation. So now I turn it over to you, Dr. Jee.
So good morning, good afternoon, good evening, depending on where you are. And it is my great pleasure to share with you the Korea's public health responses to COVID-19 outbreak. So if you can turn to the next page, please. So you can see the outline of my talk from the screen. So I will just skip the outline. The next page, please. So with continuing threat of emerging infectious diseases, the concept of the health security has emerged several years ago. And with current crisis we are facing is teaching us how the virus can be really devastating and with a huge impact on economy and also all aspects of our lives. So with that background, the Global Health Security Agenda was initiated by United States and endorsed by G7 in 2014. Now with the 67 member states participating in that agenda, and there is a steering group of around 10 countries. Current chair is Netherlands, and Korea was chair in 2017. And recognizing the importance of evaluation of the action packages area in global health and public health, the evaluation mechanism was introduced, and that was extended to the joint external evaluation tools with 19 technical areas in collaboration with WHO and OIE and FAO. And Korea also participated in JEE in 2017 as a chair country of GHSA steering group, and this provided a good opportunity for Korea to show how much the public health national emergency response capacity has been strengthened, especially after MERS outbreak in 2015. Next slide, please. And this photo actually shows the WHO Korea joint mission, which happened in 2015. So you probably know the WHO China mission, which happened about 2 months ago. And this was similar mission in Korea during the middle of MERS outbreak in Korea. So there has been many lessons learned after the MERS outbreak, and government took the action following this outbreak. In terms of governance, firstly, Korea CDC established dedicated emergency operations center and also laboratory analysis center dedicated to the emergency control. And also Korea CDC established regulatory framework for the emergency use licensing in collaboration with Ministry of Food and Drug Safety. And also in terms of infrastructure, government tried to strengthen the various facilities, which is important for the public health emergency. Also, there was good collaboration between the ministries, the Ministry of Interior and Safety, and Land and Infrastructure and Transport, and as I mentioned, with the Ministry of Food and Drug Safety. And also we realized the importance of risk communication because there were some issues on transparency. So dedicated team on risk communication was established, and you can see the daily briefing for the COVID-19 since the first day of the case in Korea. So every morning and afternoon has been a briefing to the public and media. Next slide, please. So I just want to show you briefly the recommendations of WHO COVID-19 Emergency Committee. So as a member of Emergency Committee, I strongly recommended to organize WHO China Joint Mission to address the situation and also to assess China's response to COVID-19. And this actually happened during the February 16 to 24, and 25 experts led by Dr. Bruce Award participated in the mission, and mission provided detailed information on the situation in China. And the committee also recommended to provide support to countries and regions with vulnerable public health infrastructure and collaborate with them to WHO. Also to China, to conduct exit screening to identify the infected travelers and to minimize travel restrictions from China to other countries and to cooperate with WHO and other agencies. And committee also recommended to all countries WHO shall not immediately recommend any travel or trade restrictions based on current information available, and to be cautious not to promote stigma or discrimination against specific groups in accordance with human rights principle of the Article 3 of International Health Regulation. And based on these recommendations from the Emergency Committee, according to the IHR 2005, WHO Director General declared the public health emergency of international concern on January 30th. Next slide, please. So I want to just briefly show the timeline of early stage of public health responses in Korea. So on January 3rd, the Korea CDC activated Emergency Operations Center and strengthened entry screening. On January 6th, it allotted clinicians to look out for patients with respiratory symptoms with history to visit to travel history to Wuhan, China. And January 4 and 8, Korea CDC developed and distributed guidance for the national designated isolation hospitals for clinicians. On 17th, and the guidance for testing and management of COVID-19 and the guidance for the local government was distributed. On 20th, the government scaled up alert level from level 1 to level 2. So from this timeline, you can see that government took very early actions even before the emergency state was declared by WHO. Next slide, please. So if we see the South Korea's response to COVID-19 in different areas, firstly for testing, as I mentioned, that there was a preparation of COVID-19 testing kit for the fast track in collaboration with Ministry of Food and Drug Safety and pharmaceutical companies. And this clearly played a very significant role in responding to COVID-19, as you all know. And the number of testing labs was rapidly expanded to including public and private sectors. You can see the number really increased dramatically to 114, and this around 20,000 samples were processed per day. And also we introduced very innovative sampling method of drive-through and walk-through. So far, around 538 samples tested, and around 2% were positive as of April 16. And obviously, the testing result will tell us who should be isolated. So those will include asymptomatic cases and who should be quarantined. Next, please. And secondly, in terms of tracing the movement and isolation and quarantine, we developed the Safety Protection mobile app for the intensive tracing using GPS. And this was developed by the Ministry of Interior and Safety to keep track of the location to make sure the quarantine people are not breaking the quarantine status. And this will also allow those quarantine people to stay in touch with government offices. But still, the telephone calls will remain as an option. And we also utilize the CCTV analysis and credit card transaction log information. And this will obviously raise the question on privacy, but government actually amended the relevant law after the MERS outbreak to allow this investigation. So next slide shows the Safety Protection mobile app developed by the Ministry of Interior and Safety. And on the left-hand side, this is the Safety Protection mobile app. On the right-hand side, the the app for the government offices. Next slide, please. And we also developed COVID-19 smart management system. This was co-developed by the Ministry of Land and Infrastructure and Transport and Ministry of Science and ICT and Korea CDC. And this has been operated from March 26. So with that, actually the very fast contact tracing is possible. It used to take about 24 hours for the investigation. Now with this system, it takes only 10 minutes, and automatically all the data will be handled. And also in terms of privacy issue, there will be more strict management of personal data. Next slide, please. And government also introduced special entry procedures. And these special entry procedures were expanded to all incoming travelers starting from March 19th. So this applies to both Korean and foreign nationals. We also began the testing of all travelers coming from Europe and US. And government will hold them for 24 hours until the test results are available. And even if the test results are negative, all travelers must go into the 14 days of self-quarantine. Next slide, please. And then lastly, for the treatment, the government established the classification system based on the severity and arranged community treatment centers for mild cases to prevent the overwhelming of the hospitals to enable severe patients to be properly treated at hospitals. So mild cases were isolated and monitored at community treatment center, and the government officer will monitor them twice a day. And as of March 23, 329 hospitals were designated as COVID-19 hospital, while ensuring the hospital accessibility and safety of non-COVID-19 patients. Next slide, please. And this photo shows the community treatment center. It has been operated for the mild cases. And as of March 15, there were 16 centers accommodating 2,620 mild cases. Next slide, please. So in terms of social distancing, school closure and cancellation of major events started from the early stage of outbreak. Government extended strict social distancing now until April 19. And actually school began since April 9 by online system. The risk of communication has been very important part, as I mentioned, and media briefing has been done twice a day since the first case was reported. And I think the message was very transparent and clear, and this really enhanced public trust in government, and I think that somehow demonstrated as a result of the election which happened 2 days ago here in Korea. An important thing is the message should be really coordinated from all levels of the government. Next slide, please. And there has been some criticism about the WHO's slow action, but I just want to share with you some guidelines prepared by the WHO, such as strategic preparedness and response plan, and also the research roadmap for the COVID-19 has been coordinated by WHO. Next slide, please. And I want to show this slide because this was published just 2 days ago. This is the global strategy to respond to COVID-19 with the 5 strategic objectives, and you can just see the part which are indicated in a blue color. It does say about some restrictions on essential, non-essential domestic and international travel to suppress community transmission. Next slide, please. So what are the lessons learned from the COVID-19 outbreak so far? The outbreak is still ongoing, but I think during the course of the response, we now note that early action is the key. And also Asian countries with some previous experience from MERS or SARS performed quite well, like Korea, Hong Kong, and Taiwan. Singapore actually has some I think, increase of cases recently. And also the whole of government and society approach with the good coordination between the central and local government, different ministries, and public and private and academic societies will be very critical. And the risk communication, of course, as I mentioned. Next slide, please. So as a way forward, I think we still need to work harder to analyze our data accumulated so far. So more timely and robust analysis of epi and clinical data would be needed. And I think we also need more number of people in public health area. And in case of surge of the patient, I think we still need to strengthen our infrastructure. And interministerial and public-private collaboration has been done quite well, but we still also need to apply that for the R&D investment. And the collaboration with the WHO and global initiatives such as CEPI and GLOPID-R would be also needed. Next slide, please. I just want to share this slide to show you some website which I indicated in blue, and this has been the project by some volunteers in US, because there has been many requests for the guideline from Korea, so they have translated all those guidelines for local government into English, so you can see those the document translated in that website. Next, please. So there has been many requests from other countries for the Korea's to share Korea's experience. So there has been many interviews, I think, from all levels, and there has been the Korean minister's interview on BBC, and also our president speech during the G20 summit, emphasizing the openness and transparency and democracy on the March 26th. And there has been many requests from countries to learn from Korea, and also requests for testing kits. And I understand there will be the keynote speech of the president during World Health Assembly to share our experience, and he will be probably talking about the Korea success model for COVID-19. And I hope that the current state of the controlling COVID-19 will continue, and we can really talk about how we could be successful to control COVID-19 during that keynote speech. So I want to thank you for everyone for your attention, and I'd be happy to take any questions later. Thank you.
Thank you, Dr. Jee. Thank you so much. This is very helpful for the outline and also the timeline of the actions taken in South Korea. So let us now welcome Dr. Lee, President of the Korean Foundation, to give some remarks. Dr. Lee.
Thank you, Professor Wang. First of all, many thanks to and respects to the public health and medical personnel all around the world, risking their lives to save us. I don't think we cannot thank them too much. Without their help, I don't think we can survive in this very dangerous environment. In the interest of time, I would like to just hit the high points in understanding the implications of this COVID-19 crisis for the public diplomacy. First of all, I would like to emphasize upon the importance of the successful national models. When you have a successful national model, that model will become a very precious and valuable public diplomacy asset, or what I would call a soft power resource. South Korea has had a few successful national models. One of them is our economic development model, which is already well known to the outside world. And the second one is our democratization model. And the third one might be our model, successful model to commercialize Korea's popular culture all around the world, which is now termed as the Korean Wave. And perhaps if we are lucky and if we endeavor harder and if we succeed, we might have another successful Korean model, which is what I would call a pandemic prevention model during the age of globalization. The Korea has been quite successful in terms of preventing the pandemic or controlling the disease for a while. We do not know whether or not we are going to end up with a very, very successful model, but I think it is very important for us to succeed in controlling the disease. Otherwise, we may end up with a very, very authoritarian or totalitarian control model, which may end up with the Great Depression, shutting down the global economy all around the world. So it is very important to have a success model, and Korea's success model in terms of preventing and controlling the pandemic, which is COVID-19 this time, consists of a few elements. One of them is a very well-prepared public health and medical system, very highly qualified medical and public health personnel. That is number one. And number two is very well-educated civil society. The people are, law-abiding by the law very, very carefully. And third one is what I would call a public-private partnership in developing testing kit, apps, and also distributing the face masks. The public-private partnership was very timely and very well coordinated, so we do not have the problem of getting access to the mask anymore. And also quite flexible and agile responses by the government officials. And the last but not least, Korea's very heavily wired information society is helping us in terms of contact tracing and also sharing information of about the outbreaks of the disease. So having these elements, we have a very successful democratic, relatively open system model, so that we can, to a certain extent, maintain our daily lives and also run the economy as usual. Of course, we have to limit some of the privacy, some of people's privacy, and also our economy is not 100%. But compared with other countries, this model is relatively open, and also we can maintain our daily lives. So if this model continues to be successful, we can share this model with other countries so that other countries can also maintain their daily lives and also open up their economies and the border sooner or later. Then we don't have to end up with shutting down all the economies all around the world, so that we can prevent the outbreak of another Great Depression. And secondly, there are some people who are criticizing the privacy problem of South Korea. Of course, we also have quite intense discussion about the privacy issues in this country. However, the limitation of people's privacy was quite well accepted by the civil society in order to save our lives, in order to stay healthy. And at the same time, Korea still remains very open, transparent, and democratic. As evidenced by the national election 2 days ago, we were able to have a very good participatory democracy by participating in the national election. And also the election site was very well prepared by the government. We had 1 meter distance rule. We had sanitizers. We had plastic gloves. We had temperature checks, and people were very orderly. So we were able to have one of the most successful national election in the history of Korea's democracy. Therefore, I would like to mention again that we now have a quite successful national model that we can share with other countries. And as long as we have that one, that will be a very precious and valuable public diplomacy asset. We cannot be too complacent about our success. We cannot be too happy about what we have achieved so far. But it is very important to make this very, very successful. As I said earlier, otherwise we are going to end up with a very authoritarian and totalitarian control system that may shut down the global economy. So that's what I have in mind at the time, and I'm happy to receive questions from the audience. Thank you very much.
Thank you very much, Dr. Lee. Thank you, Dr. Jee. We have quite a few questions coming in now, and so I'm going to share some of these questions with the two of you. And for our audience, just a reminder that if you wanted to ask a question, please use the question box, and then we will relay the questions to our speakers. So here's our first question. Given South Korea's early action to address COVID-19, are there any challenges the country faced or lacked during the implementation period? Maybe Dr. Jee, you want to take on this?
I think because we prepared from very early stage, we relatively, I think, have done very well. Challenges always when you have the disease which is unknown to the people, and this is new virus. We also didn't know how easily virus spreads. So I think it was challenge for everyone. We didn't know how strictly we really managed the whole control response system. But I think we had the lack of knowledge for the virus from the beginning. And at the beginning, we didn't really know the very early stage without the symptom, even the cases can spread virus. So we only trace it from the symptom onset. We realized that's probably doesn't really include all the context. So we changed the criteria for the investigation now to the 2 days prior to symptom onset. So that kind of the trial and error, and we try to revise the guideline. I think that's good evolving process for everyone. So we also did such changes in the revision of the procedures and the guideline. But I think that's the universal for all countries and all public health people.
Okay, thank you. So we have a question about probably to both of you. So what about current situation that worries you the most, and what gives you the most hope, given what you have seen both in South Korea, but you can certainly also share with some of your thoughts about the global situation.
So maybe let me start.
Yes, please.
So so far the outbreak was focused in Daegu area, in Seoul and the Gyeonggi province, where a huge population reside. We have not seen many cases like Daegu. I think probably two-thirds of the cases were concentrated in Daegu area. But if there is some missing cases in metropolitan area where the huge population lives, and that can really be very dangerous to cause another peak. So we are always worried about that second peak in this area. So that's government is always focusing the social distancing for the moment. And I think the current social distancing cannot be fully lifted after 19th of April, and we still have to maintain some extent of social distancing to probably up to many months. I think otherwise we can probably see the increase of the cases like Singapore, I think recently. Once the school is open, I think there can be also another factor to increase the cases.
Well, Professor Wang, what worries me most at this moment is people becoming somewhat lax in terms of wearing masks and keeping social distancing rules, as we have kept the number of confirmed cases in the 20s for a few days. Now we are seeing increasingly, more number of people going to the parks, having, social gatherings. Of course, we are still wearing our masks very, loyally. However, if we become too lax, then there might be a second wave. And if the Korean model fails, then, as I said, we are not going to have another very open democratic model that we can, adopt. In that case, we're going to have perhaps a very, very severe economic depression. The only option would be the Chinese model. That worries me most.
Okay. So how has South Korea, addressed the issue or dealt with Korean nationals living overseas?
I think that should be answered by Dr. Jee. The Korean nationals living overseas, they are coming back to Korea. And when they're coming back, they are, tested at the airport, the temperature check, and they are isolated for 2 weeks. And then the government is monitoring their conditions very closely. And so far, I think, it has been quite successful. Do you want to add?
So I actually didn't catch the question very clearly. So was that question about the
foreign
any difference between national
the Korean nationals living abroad?
Oh yes. Only for the Korean nationals living abroad. Yeah. So I think we did quite good job. The government did made good efforts to really bring those people back and then test. And as Dr. Lee mentioned, we had expanded the testing for those people coming back from Europe and as well as US. And then they will be still, even though they are negative, they will be still quarantined for 2 weeks, and that has been strictly applied. There were some cases that was not really properly done, but I think most people did quite well. And so in general, I think that the whole procedure has been quite good.
I would like to mention one very interesting episode. In my area, area of residence, there are a lot of Korean students studying abroad, particularly in the USA, and they're coming back these days. And in my apartment, there was an announcement saying that, to the parents, you don't have to go to the airport to pick them up.
Oh, yeah.
If you call certain numbers, then the ambulance will go to the airport and pick the students, and then they will be isolated. Therefore, there is a lot of public-private partnership and coordination going on, and it has been done very, very successfully, I guess.
Okay. Just to follow up on Dr. Lee, you mentioned about the Korean model, and then there's also the China model. Can you expand on that? Your opinion on China's response to the current pandemic?
Well, China's response has been quite successful in terms of containing the COVID virus 19 in the very early stage. But their model is shutting down the whole economy, stay at home for a brief period of time, but it was all shutdown model. So only solution, solving the problem early and getting back to the normal life early. That's I think the essence of the Chinese model. But our model is different. Our model is having relatively open economy, but we have the contact tracing, technologies, and we also have relatively normal daily lives, and at the same time, we keep the so-called social distancing rules very closely. Therefore, Chinese model is somewhat more authoritarian and totalitarian. But their model has their own benefits, but our model is I think, more suitable to the democratic countries.
And we have quite a few questions about your perspectives or any suggestions and comments about U.S. efforts. So what should be the next step in the U.S. response to COVID-19?
I think it's quite difficult question for us. We can say that the response was quite late compared to Korea, so it's quite difficult to comment at this stage when the response is quite late. So for many countries, if it's already too late to apply our model, I think I don't know what kind of comment I can make, and I think the mitigation measures, maybe the containment is already quite late, so best mitigation measures should be implemented. So that includes social distancing. We did on the voluntary basis, but in US it's quite late because there was no clear action at the beginning. I think for the first month there was no real response. So I think it has to be really very strict. And I don't know what's going to happen in US, but the social distancing policy should really continue rather than leaving soon. So, but I heard that the President Trump is planning to lift a little bit after some weeks, but that can be, I think, dangerous. So even in Singapore, they did quite well until a few days ago, but they also have seen the increase of the cases after the school, after they opened the school. So US really need to stick more strictly on the social distancing for at least several weeks, if not months, I think.
I think politics matter in the USA. The presidential election is coming, and President Trump wants to restart the economy as soon as possible. But that is somewhat contrary to the expert opinion. And also, the USA is a very large country. It is a federal system. So you have the president, but at the same time, you have governors of individual states. And it seems to me that the coordination between the governors and the president doesn't look very harmonious. So I think the politics in the USA is a hurdle at the moment.
So in line with that comment, actually, I didn't mention about the different messaging from different level, and we also think that's very important. So hopefully the message can be coordinated between different levels, and that's really can give the trust in the government. So that should be another very important aspect of the response, I think, public health response.
So was that in South Korea's case, was there a national action plan that also coordinates with the local level, the local governments?
Yes, I think we do a very clear action plan to define the roles and responsibility and how to coordinate the the local and central government at all levels. There is very clear guidelines on that, and we have practiced that during the last MERS outbreak, and based on lessons learned during that outbreak, we are applying those lessons learned to this current COVID-19 outbreak.
We also have a number of questions dealing with communication matters. Can you share a little bit your experiences and your thoughts on how the country has been dealing with or minimizing or preventing dissemination of fake news concerning the current pandemic?
Well, that's actually a problem in, I think, everywhere. And government has official information on the website, but also providing the daily briefing, actually twice a day. And it does have all the information for the public and the media. Still, there are some information around, wrong information around everywhere. We try to really assure people that those wrong information is not really disseminated further, but somehow it's not really possible to control all those SNS information. So we try our best, but to some extent, I think it's not really possible to control 100%, like probably like other countries. But government always try to give very clear message. And compared to the outbreak back in 2015, all the information collected by the government was very fast and very transparent, and tried to give as much as possible to the public. So I think public trust in government is much higher than the last outbreak, and that was shown in the election, I think, 2 days ago.
Right. I would like to praise the efforts done by Korea's CDC, Center for Disease Control. They have been extremely professional. They have been very timely, and they have been very accurate in terms of providing information, in terms of providing, test kits, face masks. People have very strong and robust trust in the CDC. They have been, fantastic, wonderful. So there weren't a lot of rooms for fake news in South Korea. That was very fortunate for us.
Thank you. Actually, Dr. Lee, this is a question for you. You mentioned a few minutes ago about the importance of health diplomacy as part of public diplomacy. Can you expand on that, especially given the current situation that we are in?
Well, at first, I thought we had a public diplomacy disaster, because in late February, the number of confirmed cases increased tremendously. And until early March, we had a disaster. However, our Korean government adjusted very quickly and swiftly to the changing environment. And we came up with what I said, a success model. And I realized this time that Korea's public health and medical system is a lot better than we have thought ourselves. I realized this time that medical personnel and public health personnel are excellent people. I also realized that Korea's civil society is highly educated civil society. And also, I also realized, and I thank very much to the Korean government, the past and present, in terms of setting up and establishing a very good medical insurance system. I think Korea's public health and medical system is second to none in the world. I'm not saying too much about Korea's system, but this is true. This is true. Therefore, if we can succeed in curtailing and also controlling the disease within an open system, we can share this model with other countries. And if you can share the model with other countries, that is a very good public diplomacy.
Earlier, Dr. Jee, when you were discussing some of the measures undertaken by the government in response to the situation, so there was an amendment of the privacy laws. And can you say a little bit more about the issue of privacy in our response, and also going forward? What would that mean, and what does that mean to the people?
So we do have a national infectious disease control and prevention law, and during the MERS outbreak in 2015, without amendment for that law, it was really it could be a big problem to really trace all those information because of privacy issue, and that has been raised by many people. But still, without that change, we couldn't really do the proper investigation of the cases. That's what we thought, and we had a lot of discussion, and we also had some public hearing, I think. Then we, based on those hearings and all those discussions, we have decided to amend the law to allow the investigation possible. So that was a long process, but that was accepted by the public as well. So the government did apply that kind of investigation for this outbreak.
Thank you. This is a question for either of you. Do you have, is it regarding the recent, the Korean national election? Do you have any insight into whether or not going ahead with the national election was a tough or risky decision? What factors into the decision that go ahead with the election?
Well, this was a very important national election. We were electing the people in the National Assembly, and we were quite confident that we could do it, and people were eager to vote. And this is a time of crisis, and during the time of crisis, we need to have a very well-functioning government in place. Therefore, I mean, we went ahead with the national election, and I guess it was quite successful. Perhaps if there were no infections during the election time, perhaps this could be another successful Korean model that we can share with other countries, because there will be a lot of elections all over the world. In the USA, you're going to have the presidential election coming up. So this model, helps other voters to vote for their political leaders under this kind of pandemic crisis.
And luckily, this time the cases were quite low, only 20 to 30 per cases. If we were in the face of the peak, like late February and March, I don't know what kind of decision could be made by the government. But this time, the cases were quite low, and the government was able to really take all those precautions as Dr. Lee described. So it was very orderly and well performed. I think well planned and well performed, and we can see that many people actually participated in the elections. So the participation, the rate was very high this time. Very, very, very high. So
one of the caveats of our model in national election is that perhaps developing countries might not be able to take this model because it needs a lot of money. We prepared plastic gloves, we prepared sanitizers, we prepared face masks, we prepared temperature checks, and it costs a lot of money. Therefore, I think at the moment only those affluent countries can emulate the Korean model.
Okay, great. Many of people, many of our audiences are interested in if you have any latest on the development of vaccine. Dr. Jee.
Okay, so I think there are at least 2 vaccines in the clinical phase, clinical trial phase, and there are more than 60, even more, because some of the development research in many countries not really coordinated and reported to the global level, but there are many researches ongoing, and as you all know that we will really push, and we will have to minimize the process as much as possible. And recently, the WHO published the target profile product for the COVID-19 vaccine. So try to really minimize requirement for the vaccine. I think the minimum efficacy is around the ideally 70% that was described in the TPP. But if it's more than 50%, is probably still acceptable. So all the scientists and all those pharmaceutical companies are really racing together, and there are many collaborative efforts. So many the companies and scientists are working together really for one project, and those projects, I think at least more than 60 globally are ongoing. So, but out of those efforts, out of those research, and how many will succeed, we never know. So we just hope some of those research will be successful soon, and then we can expect those vaccines will be available next year. So that's our hope, and until then, probably I think the treatment, some drug positioning of research is ongoing. So that the result of the research could come earlier than vaccine. So we hope that those research outcome for the treatment will come earlier than vaccine, so that we can apply to the patients.
Great, thank you. We're almost coming to the end of program. I would like both of you to describe to us, in your mind, what would the new normal be post-pandemic? We talk about the new normal. So what is that new normal?
I think the COVID-19 really opened a new era of global collaboration, and I think that today's meeting online is one of those efforts, and obviously this need to really continue to tackle this new virus. And so hopefully we can have many further opportunities for discuss this issue. Thank you. Thank you for having me.
Well, I guess the digital tech companies will make a lot of money. Social distancing will be a new normal, I guess. And a lot of things will be done online. I think there will be less consumption, and people will be always worried about the second coming of the pandemic. So new normal will be somewhat isolated global world. There will be, of course, reorganization of value chains. Perhaps the value chains will be centered around a few very strong economies, one centered upon China, the other centered upon the US and Europe. So there will be a lot of countries that should worry about where to go in the Chinese side or in the US side. That will be a very interesting political decision.
Okay. Well, thank you so much. We will continue that conversation. Actually, in 2 weeks, CPD will be hosting another event like this, specifically looking at the prospects of from the business side and what are the implications for the policies going forward. So thank you, Dr. Lee, and thank you, Dr. Jee, for this very illuminating discussion. And I also wanted to thank all of our audience for joining us today. Please stay safe and stay well. Until next time, goodbye.